Hello, my name is Carla Osterhaus. I'm a certified diabetes educator. I work in a hospital setting teaching patients and their families how to manage diabetes. Today we will be talking about diabetes mellitus. Diabetes is common. You may know someone who has diabetes. The American Diabetes Association estimates that approximately 17 million people in the United States have diabetes. This is about 6.2% of the population. Many people with a form of diabetes called type 2 don't know they have diabetes, which may be silent in the early stages. Diabetes is chronic. It is a lifelong disease that has no cure at the present time. Diabetes is serious, but it is controllable. In order to understand diabetes, we should know about normal metabolism. Food enters the stomach where it is broken down and converted into glucose. The glucose enters the bloodstream and is carried to all parts of the body. The pancreas, which lies behind the stomach, releases insulin into the bloodstream and opens the cells and allows the glucose to enter the cells where it will be used for energy. Diabetes is a disease in which the body is unable to convert the food we eat into energy. The pancreas either does not produce enough insulin or the body cannot use the insulin effectively. As a result, blood glucose levels rise, which can lead to immediate and long-term complications. High blood sugar is called hyperglycemia. Some people have no symptoms of diabetes or attribute them to something else. Some of the common symptoms of diabetes are dry mouth or increased thirst, frequent urination, especially at night, blurry vision or changes in the vision, fatigue and weakness, which would require more naps, weight loss. Some people complain of numbness and tingling in the hands and the feet. They may have slow healing wounds or dry, itchy skin. There are different types of diabetes. Type 1 was previously called juvenile onset. It usually occurs under the age of 20, but older people can get it. In this type of diabetes, the pancreas stops making insulin. Insulin injections are the required treatment. Symptoms usually occur suddenly. This type of diabetes accounts for 5 to 10% of all cases of diabetes. The exact cause is not known, but heredity may play a role. Type 2 diabetes was previously called adult onset diabetes. You are more likely to care for patients with this type of diabetes. It is more common after the age of 40, but can occur in younger people. The pancreas either doesn't make enough insulin or the body doesn't use it properly. This is called insulin resistance. Symptoms often occur gradually. People may have type 2 diabetes for a long time and not know it. They don't notice the symptoms and feel very well. It may be controlled with diet and exercise alone, oral medications, and/or insulin. Type 2 diabetes accounts for 90 to 95% of diabetes, so it is much more common than type 1. There are several risk factors for developing type 2 diabetes. Aging. As people get older, they are more likely to develop type 2 diabetes. Obesity. About 80% of people with type 2 diabetes are overweight when they are diagnosed. Family history of the disease. Type 2 diabetes does tend to run in families. A sedentary lifestyle, doing little or no exercise. Certain ethnic groups, such as African Americans, Latinos, Native Americans, Asian Americans, and Pacific Islanders, have increased risk for developing type 2 diabetes. A woman having a history of gestational diabetes. Now, gestational diabetes is a type of diabetes some women develop during pregnancy, but it goes away after the baby is born. However, this does put the woman at risk to develop type 2 diabetes later on in life. And then other types of diabetes, which can be caused by anything that would cause damage to the pancreas, such as infections, such as pancreatitis, or having cancer of the pancreas. Diabetes management includes a number of things. Education of the patient and family is very important. They need to understand what diabetes is and how to manage it in order to prevent or delay complications and to feel good. It is necessary to make healthy food choices in order to control blood sugar and cholesterol and maintain or lose weight. People with diabetes can eat what other people eat, but portion sizes need to be controlled. And if the patient is taking diabetes medication, meals are planned accordingly. Physical activity should be encouraged as much as possible. Even chair exercises are helpful. Exercise helps to lower blood sugar and blood pressure, helps to control weight, improves flexibility, and is good for the heart. Blood glucose monitoring. People with diabetes are taught to check their own blood sugars so they know how well their management plan is working. Medication may be necessary in many cases. There are several types of pills or insulin to control diabetes. Blood pressure control and cholesterol control are also very important. The goal of good management is to prevent or delay complications. The acute or short-term complications include hyperglycemia, which is high blood sugar. The symptoms are increased thirst and urination, tiredness, blurry vision, breathing with a fruity, sweet odor, more frequent infections, dry, warm, or flushed skin. The causes of high blood sugar could be eating too much food or the wrong kind of food, not enough medication, infection, illness, or injury can raise blood sugars, emotional stress, not enough exercise, and weight gain. Treatment includes reporting symptoms of high blood sugar. Diet and/or medication may need to be adjusted and illness treated if present. Hypoglycemia, or low blood sugar, also called an insulin reaction, is another acute complication. Symptoms of low blood sugar can come on very quickly. Symptoms include feeling shaky and sweaty, lightheaded. The person may complain of having a bad headache, feeling very hungry. They may be irritable, have a change in personality, look very pale, and complain of weakness. The causes of hypoglycemia are not eating enough, too much medication, or increased exercise. Symptoms of low blood sugar should be reported promptly. If not treated, blood sugar will continue to drop. A person needs to eat or drink something sweet. You may be asked to give something such as a half a glass of fruit juice, a glass of milk, half a can of soda, 6 or 7 Lifesavers, or jelly beans. Follow with a small snack to help maintain the blood sugar. Blood sugar should be tested in about 15 minutes to be sure it has gone up. The chronic or long-term complications of diabetes take many years to develop. These include strokes, heart problems. People with diabetes are 2 to 4 times more likely to have cardiovascular problems than other people. Poor circulation. When blood sugar is elevated, over time, it causes blood vessels to become thick and narrow, affecting circulation. Kidney failure, which may lead to the need for dialysis or kidney transplant. Blindness is another long-term complication. And nerve damage. Nerve damage can affect all parts of the body. Often it leads to a loss of feeling, especially in the feet. In caring for the patient with diabetes, observing and reporting any changes in your patients is very important. Know the symptoms of hyper and hypoglycemia. Also know the causes of hyper and hypoglycemia. This may help you to recognize the changes sooner, such as not eating may lead to hypoglycemia. Meals should be served on time. Be sure it's the proper diet for that patient. Report food and fluid intake, especially uneaten food, as this can lead to low blood sugar, especially if the person is taking medications for diabetes. Check with the nurse before giving any extra food. Know the storage location of juices and other easily absorbed carbohydrates. Low blood sugar needs to be treated quickly. Monitor food brought in from the outside. Well-intentioned friends and relatives may bring in food that is not appropriate for that person. Encourage exercise and activity. As I said earlier, exercise helps to control the blood sugars and blood pressure. It keeps people, their muscles and joints flexible, and makes people feel better. Provide good skin care. Avoid skin irritations and pressure points. If a person with diabetes develops an open area, it may be slow and difficult to heal. Pay special attention to foot care. Poor circulation and nerve damage increases the risk of injury and infection. Wash feet daily, carefully drying between the toes. Inspect feet closely for any breaks in the skin or signs of irritation. Apply lotion to dry feet. Toenails of a diabetic are only cut by a nurse or podiatrist. Care needs to be taken not to cut nails too short or to nick the skin, as this increases the risk for infection. Shoes and stockings should be clean, free of holes, and fit well. Anything that might injure the feet or interfere with circulation must be avoided. Do not allow the resident to go barefoot. Stepping on something could injure the feet. Prevent pressure over toes and feet by not tucking in bedding tightly. Avoid very warm or cold applications to the skin, as the resident may have some loss of feeling. You will care for many patients with diabetes. You are the key person working with the patient. Your observations are very important. You may be the first person to notice day-to-day changes. Watch for and report any changes, as this could affect the health of your client.